Hey guys, my name is Tiffany Galloway. I'm a student at Houston Baptist University, and I just wanted to take a few minutes of your time to show you guys how to do simple interrupted sutures. Just a little information, a little education. There are several different types of sutures that you can do: simple interrupted, simple running, horizontal mattress, vertical mattress, buried sutures, or even a flap. But the most common that you're going to see in your practice is called simple interrupted. So that's what I'm going to do today. First things first, I want to give a little shout out to a friend of mine, Dr. Rahimi. He's the co-founder of the Suture Buddy, and I'm going to be using his product today. I did a class with him and he showed me all the pearls of suturing, and I really appreciated that. So first thing you're going to do is make sure that you don PPE, put on your gloves and everything, rinse out the cut really good, make sure that you get out all that bacteria because you don't want the patient to get an infection. I have done this video several times. Last time I did it, I went over a little bit, so I'm doing it again, but that's why my kit is already open, and you see that I have my nylon 3/0 suture already out. So I'm gonna grab it with my clamp and just a few millimeters away from the end. The end of that needle is actually the weakest point, and you do not want to go, you don't want to grab it there, because when you try to put it through the skin, it's going to be weak. It might bend, it might break off. So grab that, grab your forceps, pick up that skin, and you go right in the middle of the laceration so you can split it in half. If you're a beginner, you should actually put it in one side, pull the needle all the way through, and then reload, grab it again, not all the way. It should be perpendicular with your clamp. So not all the way at the end, but a little before, and you're gonna, again, put it all the way through. Grab it, put your needle down, make sure it's safe, and I'm gonna do a surgeon's knot, which is where I'm gonna wrap it around 2 times the end of this clamp, and grab the other string and pull it taut. So there we go. The next knot I'm gonna do is called a square knot. Wrap it once around, pull the end through all the way, do that again, square knot, wrap it once around, pull it all the way through, tie, and one more. So whenever you're doing these knots for a simple interrupted, you wanna make sure that it's 2, 1, 1, 1. You're gonna do 4 throws on this suture, and the first one is gonna be a surgeon's knot. The second one is going to be a square knot, a square knot, a square knot. So very simple. Cut the ends of that, reload your needle, and move on to the next one. So now that I'm a little more comfortable, not to mention I've practiced this a few times, I'm gonna go straight through, all the way through. So I'm gonna go all the way in, all the way in. Pick it up, pull out a tail. If you're a beginner, you should leave about 2 inches of the tail. If you are a little more comfortable, you can do less, but you wanna make sure that there's room for margin. So I'm gonna do the surgeon's knot, which is 2. Tie that. Now I'm doing the square knot, which is 1, tie, 1, tie, and 1 more, and tie. So that one's nice and good. Hold on, I slipped away from me. There we go. Cut your ends. There we go. Reload my needle and move on to the next one. Grab it, pull it through, a little bit of a tail, and then go right into your surgeon's knot. 2 twist, 1, 2, grab it, pull, square knot, 1 time around, grab it, pull, square knot, grab it, pull, 1 more, grab it, pull. So there's different things that you guys need to remember when you're putting in sutures. Depending on where they're placed, you need to make sure that they come out at the appropriate time. One of the most important things is with the face. Babies, things like that, they're always falling on their head, on their face, they get small lacerations, and you need to make sure that due to scarring and things like that, those sutures come out within 3 to 5 days. You don't want to leave them in more than that because there can be a really bad scar left behind. So I'm going to do a surgeon's knot, square knot, square knot, and then one more time, the last square knot, and that's good, and then trim the end. I'm going to do one more suture here, and then we can be done, guys. Pull it all the way through. Do a surgeon's knot, which is 2 times around. Square knot 1 time. 1 time. 1 time. Okay, so that's it. Just one more quick pearl that I just want to show you. Like I work in the emergency room, we're very busy. Sometimes we have to get called out of patients' rooms. If you leave, make sure that you protect your needle. You can grab it with your little clip and lay it. So I'm closing it, protecting my needle, and I can lay it right down on my field and come back to it, and I know my needle's protected, and I know that nobody's at risk for getting punctured by a sharp. So always remember that as well, and thank you so much.